Innovative communication strategies can break down barriers, ensuring that critical health information reaches even the most remote areas.
Who is the community? Well, of course, the community is people. We, each one of us, are part of a community. When we think of the various components of the community, each one of those groups have strengths and each one of them have capacities and capabilities. So let's take a little bit of a deeper dive right now and look at the various parts of the community. First of all, right in the middle, if we think about the community, we're thinking about individuals, we're thinking about neonates, we're thinking about infants, adolescents, young, middle age, and old. We're talking about the boys. We talked about that earlier. We can't forget the boys, the girls, men, and women, able-bodied and those that are disabled. They all have their rights and responsibilities. And we don't commonly emphasize the adolescent as being part of the community or as community. We don't really think of them that way because they don't seem to be the decision makers in society. But they are making individual decisions themselves that affect the whole community. They're making individual decisions about their own reproductive health. Think about the 16-year-old girl in secondary school who becomes pregnant and delivers. Her whole community, her whole family has changed, and the trajectory for that young life is going in a total different direction. When we think about education, at all levels of education, the messages of safe motherhood and the pillars can be incorporated to meet the needs of the individual students, whether they're in primary, whether they're in secondary, or whether in post-secondary education. We know each person has a basic right to education, irrespective of their religion, gender, economic status, and age. What is the family's vision of health, and how does that impact the everyday decisions of each individual in the family, whether it's the children, whether it's the parents, whether it's the extended family? When families are making good decisions and advocating for safe motherhood, then the local, regional, and national governments will usually follow suit, because those people that are in the government are the very ones that are part of a family. Every government level, from families right up to Parliament, can be part of the fabric of safe motherhood. It's really vital, as we know, that health facilities are distributed with access to all, and that in those healthcare facilities, and we've already chatted a little bit about that there's each of those required critical services. A woman doesn't choose her complication of pregnancy. If she has a postpartum hemorrhage, if she has an infection, she needs all of the services available there. There needs to be good communication and informed consent for that mother with respect, privacy, and cultural sensitivity. We know that businesses are an important part of safe motherhood. They're the nuts and bolts that really make it a reality. You think about the transportation sector that brings the mother to the healthcare facility, the telecommunication business that allows the mother to call for help, the financial institutions, thank you to the banks for providing the currency and managing the currency to purchase the materials necessary in the hospitals. They all contribute. And they may seem very indirect, but the chain of safe motherhood quickly breaks down if those are not there. No vehicle and no transportation means the mother does not get to the healthcare facility. But information isn't enough. People need to have a way to actually engage. And when we think about communities, they need to be actively asked, how do they participate in things like accountability for healthcare facilities when they've received monies? They need to be able to be engaged when a mother has died in the community. How do they follow up on those maternal deaths? One way of reaching the hearts and minds of the maternal health is through the Masters of Public Health Leadership Program that I've been part of with many colleagues. It is directed by Save the Mothers at the Uganda Christian University. And this program is targeting multidisciplinary professionals. We've had over 570 students who've joined the program from Uganda and other East African countries. And Save the Mothers graduates are advocates in 15 different health centers across Uganda. The Mother Baby Friendly Hospital program involves particularly the high dependency units that was developed in association with the Mother Baby Friendly Hospital. The Mother Baby Friendly Hospital program also provides a dignified delivery, simple things like privacy and curtains, healthcare workers being trained in culturally sensitive communication, and of course a safe delivery, ensuring that there's adequate and essential medications available for mothers. And again, just organizing what we have to be the most effective that we can. It really prioritizes as well community engagement to ensure that there's dialogue with the community and their input into the healthcare facility. The Mother Baby Friendly Hospital is looking to expand into more regions and health centers across Uganda and East Africa, and we're looking to the Ministry of Health to really help us to incorporate the Mother Baby Friendly Hospital into routine care across the country. Other examples of reaching into the hearts and minds, we think of the National Maternal and Perinatal Death Review Committee, again having community members on that committee so they can be part of the discussion and give their views as well too in the planning and recommendations of that committee. These again are speaking into the hearts and the minds of people. It's not just technical, it's getting people engaged. How do we stay strong? How do we deliver the maternity care for mothers and babies for the next decades to come? We just can't hold our own. 25 years from now, we can't simply be doing what we're doing right now. Well, how do we do that? We have to be intentional, we have to be persistent. And I think we can learn a lot from the business world. You look at Coca-Cola and Pepsi, they're constantly getting our attention. They don't advertise once, and they're also changing their message for the ever-changing consumer as well. So how do we get the community involved? Well, the community becomes involved with positive reinforcement. When they see the statistics, they know that they're relevant and important for them. We can't speak to them about maternal mortality ratios. We have to have understanding of, they need to understand the words that we're using. We need to use maternal and mother testimonies, individual stories being shared, and really recognize contributions and excellence, and examples again of the maternal awards that are being given. These again are very, very important. We've been challenged at the level of the community to become strong and to stay strong. We know that a healthy mom brings a healthy baby and gives us a productive society.